This is Andrea Grimes, a journalist and stand-up comic living in Dallas, Texas. You won't be able to tell from this picture, but Andrea suffers from a condition called cervical intraepithelial neoplasia, a potentially cancerous abnormal growth of the cells on the surface of the cervix. To combat this abnormality, she needs regular, affordable pap smears. Luckily for her, she lives within distance of a Planned Parenthood clinic, which provides her with low-cost paps, breast exams, and contraceptives to keep her healthy and alive, despite her lack of insurance. But unfortunately, Texas State Representative Dan Flynn and other politicians in both state and federal levels want to strip government funding from Planned Parenthood, preventing people like Andrea from receiving the reproductive health care they desperately need. Andrea, like other women, men, and children, depend on Planned Parenthood for vital reproductive and sexual health services such as HIV counseling, STD treatments, cancer screenings, health education, and much more. Hence, taking away funding from this organization will put millions of people at risk without any chance of receiving adequate medical attention. One may not agree with the organization's stance on abortion, and that's perfectly fine. But he or she must recognize Planned Parenthood's nationwide impact and role as a critical healthcare provider. And thus, because it positively affects millions, because the government has no other alternative, and because it is cost-effective, Planned Parenthood ought not be defunded. There would be no debate over Planned Parenthood's funding if it wasn't for the extraordinary number of people the organization affects. After all, it would only make sense for Planned Parenthood to receive governmental aid if it affects many people. And undoubtedly, there are many people. With over 800 health centers throughout the country, Planned Parenthood is the largest organization dedicated to the promotion of reproductive health, safe sex practices, and family planning. Using this large network, Planned Parenthood is able to reach and offer services to the majority of the country. Using data from the 2010 census in the U.S. Department of Health and Human Services, one finds that the total population that may be dependent on Planned Parenthood is well over 260 million. Therefore, if the federal government denies the organization federal funding, which constitutes a third of all of Planned Parenthood's income, it will be leaving 84.3% of the country without access to Planned Parenthood's wide array of affordable, quality healthcare services. These are certainly significant numbers, but critics continue to say, so what? They claim that women can simply go to their local hospitals or apply to state-run health programs to receive the attention they need. This may be true, but more often than not, these local hospitals and programs only help a limited number of people. Those who can pay, those who are insured, and those who are in life-threatening situations. For those who, like Andrea, are lower class, uninsured, and are in need of prolonged preventive care, these alternatives have absolutely no effect. This is where Planned Parenthood comes in. No government program has the same reach, tools, or willingness that Planned Parenthood does. So state and federal programs often rely on the organization to distribute sexual and reproductive health services, which they cannot provide themselves. For example, in Connecticut, Utah, and Wisconsin, only Planned Parenthood grants federally funded reproductive health care services, not the state's Department of Health or any other program within the state. In Vermont, while the state's Department of Health does receive aid for reproductive health, it gives it all to Planned Parenthood. And in many other states, local and federal programs such as the Texas Breast and Cervical Cancer Services actually refer clients to Planned Parenthood clinics because they cannot offer the same affordable services they do. With such examples, one can see that alternatives are not necessary because Parenthood makes up for the inefficiencies of the state. Eliminating aid for the organization, therefore, will not only cripple millions of people, but will also force the government to provide more adequate programs instead, resulting in increasing costs for taxpayers. And since we are on the topic of money, let's explore the fiscal benefits of providing government aid to Planned Parenthood. Contrary to some politicians' belief, publicly funded family planning services are highly cost-effective. According to the Guttmacher Institute, more than 9 in 10 women receiving them would be eligible for Medicaid-funded parental delivery and postpartum care services if they became pregnant. Avoiding the significant costs associated with these unintended births saves taxpayers $4 for every $1 spent on family planning. Also, many low-income women, men, and children get their basic health care for the year during an annual visit to a family planning center. The package of services they receive not only includes contraceptives and the contraceptive method, but it also includes pelvic and breast exams, tests for HIV and other STIs, screenings for reproductive cancers, high blood pressure and diabetes, and referrals to other health providers when necessary. This is essential, preventive health care for disadvantaged patients. And again, Planned Parenthood's nationwide reach is to thank. According to the Washington Post, about 73% of Planned Parenthood's clinics are in rural or medically underserved communities, which is why many patients go to them for non-reproductive services, saving money for both the patients and their government. All in all, Planned Parenthood saves the government an extraordinary amount of money simply by doing what the government cannot. Hopefully, lawmakers will see that helping this organization carry out its mission is not such a bad investment. This all may seem like very compelling evidence in favor of Planned Parenthood, but unfortunately, some politicians refuse to see past the organization's support of abortion and continue to resist aid. What they don't understand, however, is that doing so is not only ignorant, but it also counterintuitive. In defunding Planned Parenthood, the government would be failing to follow through on its commitment to provide reproductive health care services. With the enactment of Title X in 1970 by President Nixon, a Republican president, ironically, the United States government has committed itself to providing individuals with comprehensive family planning and related preventing services to all who want and need them. To go against Planned Parenthood, an organization that meets all of Title X's requirements and standards, is to essentially go against the government's self-imposed obligations to its citizenry. It would have been fine had the government had any other suitable alternatives to offer people who are in dire need of reproductive health services, but it doesn't. Politicians must therefore fund the only existing option that grants all people with quality, affordable benefits, the option that millions already count on for help, the option that saves taxpayers money, and the option that is best among all other options, Planned Parenthood. And thus, I urge you to contact your representative and let them know that unless they come up with a better answer, one that is as helpful, affordable, and cost-effective, they must continue to fund Planned Parenthood and ensure the government of the people, by the people, truly does act for the people. Thank you very much.
It's too strong of a statement for me to hold the applause. Yeah, too